What is inside that nose? What is that, a seed? What is that? I think, what, is that an almond? Why is he sticking an almond in his nose?
There are many techniques for nasal foreign body removal. Here is one method using a balloon catheter. This child put a wad of tissue in his nose. First, check to make sure the balloon inflates and lubricate the catheter. If you're going to use a small Foley, a 5 to 8 French should work. Just cut off the tip distal to the balloon. The catheter gets inserted past the foreign body and the balloon gets inflated so you can pull it out. Make sure the parent and an assistant have a good hold on the child. Insert the catheter into the nose, past the foreign body, aiming straight back. Inflate the balloon with 2 cc's of air and gently withdraw. And that is why you don't stick tissue in your nose.
I actually learned something new reacting to this video today. How often does that happen? Not commonly. But that makes a ton of sense. You just stick that in, you expand the balloon, you pull it out. I mean, we both learned something new today. Is that chicken bone? How is she awake for this? Oh, how do you swallow that? How would you swallow that? Look how sharp that looks. It looks like a freaking shark tooth. So what happens if you swallow, let's say, a fish bone and you can feel it stuck in your esophagus? Well, the easiest thing to do is to actually eat some rice. Now, a lot of times if you're having fish, maybe you're at a restaurant and they're serving it with rice, or you're at an Asian restaurant and it's served with rice. But if you eat rice, you get some bulk there. A lot of times it will dislodge that bone and actually push it through. The problem, obviously, with having a bone in your system is that it can, get stuck in an area of your intestine that's nice and smooth, and it is, let's say, kind of fragile, and that can be an issue. And that's why having bulk there, like in the form of rice, can help to move it through and make it so it's not a problem. There's a puppy? What's inside the puppy's nose? Oh my gosh! How long is that? Oh my Lord, how did that puppy put that in his nose? That poor little pup, how much must that have hurt? Oh my gosh, I love dogs. Why do they do this to themselves? Definitely don't try this at home. If something like this happens to your dog, please, please, please bring your dog to a veterinarian. Ooh, that's big.
Sure? Ooh. Okay, I'm pretty sure we numbed it.
All right, yank that out. Yank it out.
Gonna wiggle it.
Why aren't you just yanking it out?
Actually, we have Vaseline right here for that. I'm just gonna dip this.
You don't need Vaseline, just yank it out.
Slide it up here. Okay. We're gonna start.
Wait a minute.
Oh, this is real in there.
Wait a minute.
It's okay. I'm gonna. This will help the swelling.
I don't know about this. This doesn't look real to me. This looks sus.
You tell me. You have to tell me what is this.
Look, there's no movement in that thumb.
Okay, we got
Maybe
it.
we should speed this video up.
Wiggle your thumb a little.
Look at this, a bunch of talking and nothing. Yank it out. What do you think? Just pull the rest of it out. What are you waiting for? It looks like it's like string. How do you get string in your thumb like that?
Yeah, it looks like
Stop
it's
your
in the side of
yapping.
your thumb. It's in the side of your thumb, like through the calluses.
This is ridiculous.
Beautiful.
Why do people make videos that are so obviously fake like this? And the problem is that these videos often go viral because people actually believe that this is real. You're not going to get a string stuck in your finger like that. It's got to be something that's hard, that actually penetrates and moves through your tissues. You can see they probably had the 4 fingers of her hand, and then they wrapped it and put a fake thumb there and tried to pull it out. What's the point of this? Why are you lying? Have you tried my exclusive skincare line, Yoon Beauty? Our products combine natural and organic ingredients with the latest and scientifically proven anti-aging components like vitamin C, retinol, and peptides. If you're looking for healthy and youthful skin without the unnecessary chemicals, fragrances, and additives, then this is the skincare line for you. I'm so convinced that you will absolutely love my skincare products that I've instituted a 30-day money-back guarantee. Check them out at younbeauty.com and enter the coupon code 20OFF to get $20 off your first order over $99. I'll put a link in the caption below. What is that? Look at that. How do you get something like that stuck in your ear? This doesn't even look like a child. Look at the hair. There's like gray hairs. What is that? What would this old man do to put this in his ear? Is that like a pill? Why are you stuffing a pill in your ear, dummy? So what happens when you have somebody come in and you're like, hey, I prescribed you some Viagra, and they're like, doctor, I stuffed one inside my ear canal. Huh? Like, why? I mean, I've been a doctor for 25 years, and I've seen a lot of stories, and sometimes we do weird things, but this is just kind of strange, and you want to always give patients a benefit of a doubt. There are kind of strange people out there and stuff happens, but why would you stick a Viagra in your ear and get it stuck? I don't get it. Maybe if you have an idea, please leave a comment in the comments below, because let's go to the next one.
In this case, is a poor little munchkin. She stuck an eraser in her ear, so we're gonna go retrieve it.
So you can definitely see the eraser in the ear canal here. And while I retrieve this thing, I'm gonna teach you some important facts about ear canal foreign bodies, with the last one being the most important. The first one, our ear foreign bodies are more common in the right ear, as most kids are right-handed. The second thing is most of these kids that place things in the ear canal are age 2 to 6 years old. The third one is boys are more likely to place things in the ear canal as they take part in more risk-taking and exploratory behavior. And the last, most important one, if you think the child placed a battery in the ear canal, this is a true emergency and should be taken to the ENT or ER stat.
Got the specimen, gonna take it to mom now.
So this is my friend, Dr. Sina Jarabci. He is a doctor, he is an ENT specialist, and he's very active on TikTok and on Instagram. And I thought that this was very educational. Now, the whole thing with the battery, this is really, really important. What can happen is if you have these little watch batteries, and you're talking about those little round ones that come in watches and other small electronics, these are extremely dangerous. If you swallow them, if you get them put inside a body part and they stay there, because they can actually drain acid, believe it or not. When you actually take one of those batteries, and I did a video of this way a long time ago at TikTok, where I took a piece of ham and I put a watch battery in between the ham and left it for a couple hours, it actually leached acid all around it and burned a hole in the ham. This is a big deal. So if you ever see or know of a child who swallows a battery or has one stuck in an orifice, you gotta get it taken care of emergently. This is not something that you wait on. No, a botfly? Oh my Lord. Oh my God. That has got to be the scariest thing I have ever seen. I could not ever imagine having a botfly in any part of my body. No, thank you. Ooh, what is this? What is that? Why aren't you just pulling it out? Is it like a worm or something? What is that? Wait a minute. That looks like a gummy worm. Let's speed this video up. This is a waste of our time. Let's speed this thing up, and there we go. Keep pulling on it. Keep pulling, keep pulling. It looks like a gummy worm. That doesn't look real. Why is it green like that? Come on, pull it all the way out. Let's see what it looks like when you pull it all the way out. Why don't you just yank it? Why are you so slow? Here we go, here we go. All right, it's almost out. Pull it out. It looks like a gummy worm. Now what are you doing with the hole? There's no blood, there's no fluid. That's sus. There's no way that's real. Why do people do this? It looks real initially, but then you figure it out. They lie. Ooh, thought you were getting a splinter.
Right.
What is that? It looks like a
bug.
Bug, like a tick or a cockroach.
Is it a fucking
Ew.
bug?
What is that? Pull it out. Oh, I don't think that's a bug. That looks like some type of plant-based material or something. I don't think that's a bug, but it did look like one. There's so many crazy foreign body videos out there, and there's one where literally it's the head of a snake coming out of an ear. How do you get a snake in your ear? You gotta take a peek at it in this video up here. where I react to more foreign body removals. These will blow your mind. And as always, remember to eat real food, use clean skincare, and auto-juvenate before you operate.